Hey guys, good morning. Or is it afternoon? I don't know. It's almost, yeah, it's still morning. All right. Guys, Dr. Nathan Thompson here with Exemplify Health Center, a Wellness Way affiliate right here in Yorkville, Illinois. And I am here with a good friend of mine and new team member here in the office, Dr. Brian Coker.
Hello.
Dr. Brian just started in the office about a week and a half ago, or actually last week.
Yeah.
And so Dr. Brian is going to be taking over some of the responsibilities and duties that were here in the office. And so I wanted to introduce you guys. Please say hello to Dr. Brian. I know that we made a post about it on our Facebook page, but I want to give Dr. Brian, as we wait for people to jump on, I know that I'm going early today only because I have a meeting regarding an event coming up at 7 o'clock that's going to run a little bit long. So I wanted to make sure we went over the whole issue about ice. I'll explain it in just a second. But before we do that, while people are jumping on, I want Dr. Brian just to be able to say hello and tell a little bit about himself. So Dr. Brian?
Hello. Hi. Yep. So I've been in practice almost 25 years and have seen all kinds of things, done all kinds of stuff. Been heavy into nutrition, of course, and metabolic things, but have really enjoyed and excited. Actually, feel very blessed to be part of this team now. Everything that I see Dr. Nate doing is exactly it's dead on course, and I'm excited. I'm excited to be part of this and actually to travel down this road with him and help as many people as we can get healthy.
Awesome. Well, welcome to the team.
Thanks.
Officially on video.
Thank you so much.
So coming down the road, you'll see Dr. Brian too contributing and collaborating on videos and things like that. He's a wealth of knowledge, so he'll have tons of things that he can contribute as well on this page. So again, Dr. Brian, thank you very much.
Thank you, sir.
I'll let you get back to work. All right, guys, so if you are joining us again, I just decided to go live a little bit early, so you might be watching the replay. Just go ahead, if you are jumping on, say hello for me, please. And also let me know where you are watching from. And if you are watching the replay, guys, make sure that you type in replay. And then also let me know, as always, where we are watching from. Guys, I go back and I read every single comment. Sometimes I'm not able to respond to every single comment. We do our best. But today I'm going to talk about something that is going to be a little bit controversial, okay? And I'll explain to you why. And again, this is just coming from a different perspective, coming from the wellness way perspective. And in fact, the next slide I'm going to show you, you'll actually see why I'm going to ask a question and it will start to make sense why I made this pretty bold statement, why I never ice, and other remedies that really just don't make a lot of sense. And then I also, at the end, I'm going to share with you a secret, or I want to actually say an issue or a complaint that I have with the chiropractic profession, because just remember this: I'm a chiropractor by trade. I love the chiropractic profession. I love the philosophy of it. However, it doesn't mean that I don't have any criticisms with it, and that goes with medicine, that goes with chiropractic, that goes with naturopathy, that goes with any healing art if it doesn't make sense, because I have no allegiance to a profession. My allegiance is actually to getting people well. My allegiance is to following the design of how the body was created. Now look, you're going to either believe two different things. You're going to believe that the body is very imperfect and that it makes mistakes, or if you're going to come from the perspective that the body doesn't mess up, the body doesn't make mistakes, and that's how, when we come from that perspective, how we're able to solve the problems that other professions can't. And so I'm going to talk about ice. Hopefully I'll change your opinion on that, but also I'm going to talk mainly today about something that's really interesting, and it's going to be about the idea of acute inflammation. You got acute inflammation, you got chronic inflammation, and I'm going to tell you something: we handle acute inflammation completely wrong, in my opinion, and yet we do nothing when it comes to chronic inflammation. So the first thing I'm going to talk about is why I never ice, and I'm also going to explain to you the acute inflammatory process, what the job of it is, and why we've actually been conditioned to believe that what the body does in order to handle acute inflammation is wrong, and it must be manipulated and it must be suppressed. And so I actually say you don't want to suppress acute inflammation, but you want to actually get to the cause of chronic inflammation especially. So when we start off, guys, and please make sure that you share this video about why I would never ice. And guys, I'm actually coming from a background prior to actually going to chiropractic school. I actually got my degree in sports medicine. I got a certification in athletic training. And so I learned all of this stuff, especially when it comes to acute injury evaluation. And I was always like, why are we doing this? This doesn't make a lot of sense. And so I had a lot of book knowledge. I didn't have a lot of knowledge outside of what I was supposed to do coming from a book and how to actually start to handle it. And that's one of my biggest criticisms with a lot of professions, is because you only know what you learned and you don't know anything beyond that. And so that's why if something doesn't make physiological sense, I don't care what profession that it is, I'll call it out and say, here's how you, in my opinion, need to start looking at things differently. It's the only way that we actually move forward. It's the only way that we actually help getting sick people well and helping well people stay well. So this is the perspective that I'm going to be coming from, guys, for today. And it's this. What if? What if, guys, ask yourself this question, what if your body didn't make mistakes? What if it wasn't making a mistake? And this is very hard for people to start thinking differently. I ask this a lot when we do our inflammation talk, and I say, hey, all right, if the body doesn't make mistakes, is high blood pressure good or bad? And everyone says, well, it's really bad. And I say, okay, now it may be bad if it never resolves itself, but there's a reason why it doesn't resolve itself, because if the body doesn't make mistakes, then the body is always trying to adapt to stressors. And it will raise your blood pressure if it helps you adapt and live longer, even if there's going to be a consequence down the road. The body is always willing to rob Peter in order to pay Paul if it means that you are going to survive longer. So is high blood pressure bad? It depends. Let me give you a perfect example. If you were to walk outside your door and you see a giant grizzly bear that's standing right at your front door ready to eat you, then doggone it, your blood pressure better go up so that you can supply more blood, more oxygen, more nutrients to your tissues, so that you can have an adrenaline response that's going to make you faster, it's going to make you stronger, it's going to open up dilate your pupils so that you can see your surroundings. Your blood pressure is going to go up at that point, and if it didn't, then you would easily become the bear's lunch. So remember, blood pressure is really a stress response, and it's a long-term adaptation if people can't get it down. And so that's why, regardless, you always have to figure out the reason why it's happening. So what if the body didn't make a mistake? And that's what I'm going to go over with you, because if you come from this perspective, you're going to say, that makes sense. If the body is not making a mistake, there's a purpose behind all of these different adaptations. Heck, heart disease, type 2 diabetes, cancer, autoimmunity, hormone issues. The body is not making a mistake. It is actually trying to adapt and trying to survive. So how does this actually apply to acute inflammation from an injury, from an ankle sprain, whatever it might be? Because I'm going to show you why we've been doing it so wrong. Now, when we talk about inflammation, most of the things that we describe when it comes to inflammation is actually acute inflammation. In fact, when I do the inflammation talk, I say, hey, guys, when you hear the word inflammation, what comes to your mind? Here's what comes to people's mind. Ouch, it hurts. It gets red and hot. It gets red. It gets swollen. I lose function in through that area. So they talk about redness, swelling, heat, and ouch, it actually really hurts. So if you sprain your elbow, sprain your shoulder, break a bone, sprain an ankle, you blow out an anterior cruciate ligament, with some kind of knee injury, all of those things are actually going to happen. What's so interesting is that, again, if the body didn't make a mistake, think of this. Swelling is supposed to be there. Pain is supposed to be there. Heat and redness is supposed to be there. It's supposed to be there. But guys, when you think about what we do, we try to do everything that we can to suppress, as if the body is doing something wrong. So here's actually in medicine, and guys, remember, I learned this. When I was doing my undergrad, I actually put in about 1,800 hours of internship working under orthopedic doctors. And basically what they were doing, especially when it came to sports injuries, is they were saying, take ibuprofen, put electrical stim on it, and rest it and ice it, quite a bit. And so think of this, is that, let's say you sprained your ankle. Medicine actually says, well, the body makes mistakes, the body attacks itself, especially when you're talking about autoimmunity, and acute inflammation should actually be suppressed, okay? And I don't agree with that 100% because, again, the body doesn't make a mistake. Let's say you sprain your ankle, and the first thing that they're going to do is they're going to do rice. You guys have probably ever heard of that. And guys, we're not just talking about sprained ankles. We're talking about how we're handling inflammation in the United States completely wrong. Because remember, inflammation, especially chronic unresolved inflammation, is the spark that leads to literally every single disease out there that people are suffering from. Autoimmunity, cancer, heart disease, type 2 diabetes, you name it, all of that has a chronic inflammatory spark that then causes everything else to start to adapt after that. So if you go and you sprained your ankle, we have all learned this RICE principle. One of the first things I learned when I did my undergrad is that they say, first you must rest. Rest the injured area. Number 2, you must ice for 20 minutes at a time, 4 to 8 times per day. Then you must compress it to help reduce swelling. And then you have to elevate the injured limb 6 to 10 inches above your heart in order to suppress the swelling. So what they're saying is that icing, compression, elevation, that the swelling is really bad, it serves no purpose, and you must get it out of the body because it's literally some kind of poison. And here's what's really interesting. You guys ready for this? This will blow your mind. Okay, this comes from PubMed, okay? The Journal of Athletic Training 2012. Because this is one of those things that we're just taught and we do it. And we don't know why, but we do it just because it was taught. It's kind of the same thing of, that if your child has a fever, you want to give them some kind of fever reducing agent that you must suppress the fever. As if the body is raising its temperature in order to handle some kind of bacterial viral infection for no reason. There's a purpose behind a fever. The fever is the cure. Why would you want to suppress the cure? But we're just taught that. In fact, doctors just keep saying that, and they never have sat down and thought, that doesn't make a whole heck of a lot of sense. But I'm doing it because it's just what I learned. So this comes from PubMed, Journal of Athletic Training of 2012. And it says, what is the evidence for rest, ice, compression, and elevation therapy in the treatment of ankle sprains in adults? Here's what their conclusion was, is that insufficient evidence is available from randomized controlled trials to determine the relative effectiveness of RICE therapy for acute ankle sprains in adults. So you could take that into ankle sprains, but you could take it when it comes to anything that involves acute inflammation. By acute inflammation, we're talking about acute inflammation, I'll tell you in just a little bit, can take anywhere from approximately 3 to 14 days in order to resolve itself, depending on the amount of tissue trauma. So they actually just said it right there, is that, well, we implement this, but there really is no studies to even back it up. How incredible is that? Guys, you'd be amazed at how many lack of studies there are in a lot of different areas of healing. I always tell people, hey, if you needed a open heart surgery, would you get it? And they're like, absolutely. I'm like, do you actually know there's never been a double-blind placebo clinical trial actually to prove its efficacy if it actually even extends your life? And people are shocked to know that there isn't. So this right here, there's no data and actually to back it up, but someone came up with a really awesome acronym, and somewhere it started to catch fire, and now everyone decided that they were just going to just do it. So guys, within the wellness way, we come from a different perspective, and this is how I always tell people, you will never understand why I'll do certain things if you don't come from the perspective that we come from. So within the wellness way, we always say this, look from a perspective of that the body never makes mistakes. It always is just trying to adapt, that the wellness way, that the body doesn't attack damage, or it doesn't attack healthy tissue, but the body will clean out damaged tissue. This has a huge role when it comes to autoimmunity, for example, is that in medicine they say the body attacks itself for no apparent reason, and if the body doesn't make a mistake, if you have systemic inflammation within your joints, maybe the body is actually trying to clean out damaged tissue. It's the same thing when you're talking about the thyroid. It's the same thing when you're talking about lupus or scleroderma or whatever 105 different autoimmune, different type of reactions that they've actually come up with. Maybe the tissue is infected. Maybe it's trying to clean out a viral infection, for example. Or maybe there is some kind of quote-unquote sliver that the body is trying to wall off and trying to protect you from. And acute inflammation should always be encouraged. Now, even though I learned this, all of this Rice principles, and then I started to change my perspective, it was really, really hard to just let it go and to not rest, ice, compress, and elevate. Because I've had a lot of injuries actually growing up. I understand why I had them now in order to develop empathy and be able to understand, to help people how to heal from those specific things. But guys, there's so many times where you come from, like, this is the perspective I believe, but when the rubber meets the road, you still go back to, what you are comfortable with and what you learned. So I remember, I was like, man, icing does not make a whole heck of a lot of sense. But then I remember, and this was about 9 years ago, I think, I blew out my hamstring sprinting. So, why were you sprinting as a 30-year-old? You're told to do that. No, I want to keep my function as long as possible, which means even at 40 or 50 or 60, you should be sprinting and jumping and lifting and doing things like that. And so I remember I had a severe hamstring tear, and it hurt. It felt like I got shot in the back of the leg when it happened. And I thought, hey, you know what? This is where I'm going to come from this perspective, and I'm not going to do rest, ice, compress, or elevate. So I didn't rest it. I started moving it as quickly as possible. I didn't elevate, I didn't compress, and I didn't ice it one bit. And guys, even though it looked terrible, looked nasty, got severely bruised, I was actually back to almost full participation within about 2 to 3 weeks. And normally with that level of hamstring, you're out for 8 to 10. So just think of it, is that things actually need to swell. You actually don't want to ice it and decrease the immune response going into that area, because it's that very thing, the swelling and the immune response, that brings in the cells in order to digest the damaged tissue, begin building a new lattice to connect that tissue back, and to actually go in and start cleaning up the damaged muscle tissue. And so think of it, if you ice it, guess what's happening? You're decreasing that response, which actually will make the tissue weaker down the road, which is why now I understood when I was young, I had an ankle sprain in 8th grade, an ankle sprain freshman, ankle sprain junior, ankle sprain senior, and then an ankle sprain when I was a sophomore that dislocated my ankle, and I was just chronically hurt and injured. But what did I do every single time? I rest, I iced, I compressed, and I elevated it every single time, and I did it to a T, and it left me having a bionic ankle as a result. So I want you to think of this. The body never makes mistakes. The body only attacks damaged tissue, and acute inflammation should always be encouraged, but not chronic inflammation. Okay? So when you talk about an acute inflammatory response, guys, what it comes down to is that is a function of the immune system, both for chronic and acute inflammation. So what does the Cleveland Clinic actually say about the immune system? Again, you have, Cleveland Clinic, which is, considered one of the best as far as, in medicine. You got the Mayo Clinic, which is considered the best in medicine. And guys, just remember this. I will always say, I don't care how great you are in your field, if the idea is wrong, it's wrong. So it doesn't make you an expert in medicine, doesn't necessarily make you right about all things related to physiology. So the Cleveland Clinic actually says about the immune system, here's what's interesting. They say a well-working immune system prevents germs from entering your body and kills them or limits their harm if they get in. To keep your immune system healthy, get plenty of sleep, stay active, eat healthy foods, keep your weight under control, reduce your stress, and follow other healthful habits. That's so amazing that at Cleveland Clinic would actually say, hey, if you want to keep your immune system strong, let's go ahead and keep it strong with lifestyle. But when it comes to COVID, there's nothing that you can do about it. You got to get a vaccine, okay? But what's interesting is how many times have you guys gone to a doctor and they say, hey, you know, you need to eat better, you need to lose some weight, you need to make sure you're getting sleep, you know, and make sure you're eating healthy foods. But a lot of times it doesn't go beyond that. It's just, they just say that's what you need to do, but you say, hey, doctor, tell me how to do that. Please help guide me through that process and test properly. And that's what we do within the Wellness Way approach, is we do a great job of actually helping to coach you with all of these different things, including reducing your stressors in order to help build an immune system response. Remember, most of what people die from is actually because of an inflammatory or a low immune system response that actually can lead to infection. So they're actually saying, yeah, lifestyle can actually improve your immune system, but what's interesting is you probably don't have to look very far, and they're going to talk about you have to get the COVID vaccine, and that's the only way in order to really recharge your immune system, which is completely false, fake, phony, and bogus. Now, here's what they say about the immune system. Your immune system is a large network of organs, white blood cells, proteins, and chemicals. This system works together to protect you from foreign invaders like bacteria, viruses, parasites, and fungi that cause infection, illness, and disease. And so you can see all of where your immune system is actually sit. What's interesting about the immune system is most of it doesn't sit within the blood. Most of it actually sits within the barriers. Underneath the skin, GI system, lungs, genitourinary tract, most of your immune cells are actually sitting there, because where's the best way in order to fight the battle? To fight the battle at this castle wall and not wait until the invaders are already within the castle. So they'll say, you know, things regarding this, and it actually, you know, I agree partially with that, and I agree with this, although they could go into a lot more detail. So WebMD actually talks about inflammation, because if you type in inflammation, the first place that are going to take you there is, because they don't suppress things when it comes to medicine, is it takes you to WebMD when you ask about inflammation. And here's what they say. Inflammation is a process by which your body's white blood cells and the things they make protect you from infection from outside invaders, such as bacteria and viruses. But in some diseases, now here's what's interesting, like arthritis, your body's defense system, your immune system, triggers inflammation where there are no invaders to actually fight off. So, and this is what they're talking about with autoimmune disease. So if in these autoimmune diseases, your immune system acts as if regular tissues are infected or somehow unusual, causing damage. So this is why they've been so wrong when it comes to handling autoimmunity. It's also one of the reasons why they haven't figured out why autoimmunity continues to skyrocket. It's one of the fastest growing illnesses in the United States, and it's actually one of the fastest growing illnesses when it comes to women 20 to 40 years of age, is that they say, well, you know, in the case when you get a lot of joint pain and you're having a lot of acute inflammation, the immune system's somehow messing up. No, it's not. It's trying to clean something out, and you need to figure out what the actual trigger is. Otherwise, if you don't, you're going to spend the rest of your life taking corticosteroids or some kind of immune modulators that will actually down the road lead to cancer, because they're trying to knock out the immune system. And that's what they say about inflammation. Inflammation can be either short-lived or acute, or long-lasting chronic. Acute inflammation goes away within hours or days. Chronic inflammation can last months or years, even after the first trigger is gone. Conditions linked to chronic inflammation, now listen to this, WebMD, is linked to cancer, heart disease, diabetes, asthma, and yes, even Alzheimer's disease. Okay? So the issue is that we are, as a country, we try to suppress acute inflammation, and we don't even talk about chronic inflammation. But what we do is we try to drug the effects of the chronic inflammation, or try to knock the immune system out because of chronic inflammation, rather than try to actually get to the cause and figure out, if the body doesn't make mistakes, there's a reason why all of these different things are actually happening. So I want you to think of this. Your immune system reacts to two things, and this will make it very easy. It reacts to foreign proteins. Okay, so protein structures, you know, on a virus, protein structures within the cell wall of a bacteria. But what's interesting is it will also react to proteins within foods if they are allowed to leak through the gastrointestinal barrier. That is one of the things that can cause a lot of inflammation systemically. So it reacts to foreign proteins, but it also reacts to something else, and that's called damaged tissue, which it's supposed to, because it's there to help rebuild, repair, clean out, and regenerate damaged tissue. And this right here is one of the biggest things that we see when it comes to acute inflammation, because yes, it hurts, yes, it gets swollen, yes, it gets hot, yes, it gets painful, and then we say, well, the body's messing up, we need to somehow suppress it. But here's what's interesting too, is there's other things besides just your joints and injuries that are symptoms of acute inflammation. If you get sick, for example, you get the flu, you're going to develop body aches, fever, and swollen lymph nodes. And so many people freak out because they think, oh my gosh, something is going wrong here. And so this is why we say, well, I'm just going to take some Tylenol, take some aspirin, suppress my fever, and the swollen lymph nodes, this is really bad. All it is the immune system mobilizing itself, trying to filter the virus in through these lymph nodes where some of these T cells can start to handle it. It's just what it is. So this is why they call them lymph nodes, because lymphocytes are specific types of white blood cells that are handling specifically viruses and things like that. So that's where the body takes the actual infection, and where these cells are actually starting to mobilize. So these things are also acute inflammation. So in the same breath, when I say, hey, I wouldn't ice for an ankle sprain, wouldn't ice if you had some kind of joint injury. But this is also why, if your child has a fever, we never give them Tylenol. We never give them aspirin. And I know what people are saying. Oh my gosh, you could have a seizure. No one has a seizure from a fever. They're having a seizure because of the infection, not because of the fever. Now, if you break a fever very quickly, a child, for example, can have a seizure, febrile seizure, as the body resets its temperature, and it's benign. I've seen it happen literally right after we adjusted a young baby. Parents freaked out. I said, everything's fine. They're going to be great. We want to take them to the hospital. Took them to the hospital. The doctor's like, it's febrile seizure. They're fine. And they were. So, but same thing when it comes to joints, or same things too, that when we get sick and we're trying to suppress. I never ever want to suppress what the body is doing to handle some kind of infection, because again, we're coming from the perspective that the body never ever messes up. So I want you to think of this, okay? What is the immune system supposed to react to? Remember, we said foreign proteins, and it also is to respond to tissue damage. So I want you guys to look at it more when people do have inflammation, is look at it if you had actually gotten a sliver, okay? This is also true when it comes to autoimmunity, is I make the comparison of saying, hey, it's almost as if there's a sliver in your body somewhere, and that unless you remove the sliver, the body will always try to get rid of it. So I want you to think of where we are putting a foreign protein that bypasses the barrier and enters within the body like a sliver. So I want you to think of things like, well, breast implants, joint implants. Those are just two things that come off the top of my head. But also food allergies are introducing a foreign protein through the gastrointestinal barrier. But you know what it actually is a really big one too? Is vaccines. That is the introduction of a foreign protein by bypassing the barriers as well. That's why it's always done backwards. That's what we talk about at our Make Immune Systems Strong Again talk. And when you guys understand physiology, you're like, you're right, that doesn't make a whole heck of a lot of sense. And so what happens is tissue damage, you're going to have an immune response. These immune cells actually come in, they release inflammatory chemicals that cause swelling and redness, and that inflammatory chemicals actually will cause more white blood cells to go to the area to start the healing and repair process. How do they know where to go to? They're attracted to what's known as chemotaxis, by a chemical response that draws them to that area. It's almost like white blood cells, the way that they actually send out the alarm. It's also like they're almost sniffing where the area is actually damaged. And this will continue to happen until sufficient healing has actually taken place, which can take anywhere from 3 to 14 days, depending on how much tissue damage took place. And it's the same thing when you have a sprained ankle. When you have a sprained ankle, you actually will tear tissue. The tearing of tissue and tearing of blood vessels will actually cause blood to leak into that area, form a natural splint, and the damaged tissue actually through chemotaxis will actually cause migration of certain cells to start to repair that area, but also to digest the damaged tissue. So when you think about it, it doesn't matter how ugly it actually gets. The whole idea is if that is needed, why would you want to slow that down? By suppressing it with ice. And in fact, you can actually look at the literature and they'll say that people who took ibuprofen after a fracture delayed their healing significantly. And what did they do? They delayed the acute inflammatory process. So when you try to suppress the acute inflammatory process, guess what's happening? You are delaying a normal healing response. And so that's why acute inflammation should be encouraged, and chronic inflammation, you should actually be finding the cause as far as why it's happened. So just like we said, again, the immune system reacts to foreign proteins and damaged tissue, which means if someone is inflamed, the first things that we're trying to say is where's the sliver? The other thing that we're saying is what's the function of the barriers? Are the barriers staying healthy? Because if they're not, that can cause a lot of chronic systemic inflammation. Or also, where did the injury occur and why did the injury happen? Because many times where the injury happened, the cause is somewhere actually downstream. So I want you to think of this. If the body doesn't make a mistake, then why on earth would you ice a sprained ankle? Why would you ever take fever-reducing medication? Why would you ever take antibiotics? Me and Dr. Nate, you would never, ever take an antibiotic? Nope, didn't say that. But what I'm saying is that we take an antibiotic for everything. Heck, we'll take an antibiotic for a viral infection. And so I never would want to go down the road where antibiotics didn't exist. But a lot of times people come in and they're experiencing a self-limiting acute inflammatory response from an illness that they'll have no problem getting over. And because they go to the doctor and the doctor says, hey, you know what, you'll heal from this on your own, that actually will upset a lot of people. So the doctor says, just go ahead and I guess take an antibiotic, and people are happy. Okay, now I'm going to take this antibiotic now. And meanwhile, it should have never ever needed in the first place. What about constantly taking pain relievers? Now I understand that a lot of people are in a lot of chronic pain. It sucks. It really does. I've been in chronic pain before in my life as well. But the only thing you're doing by constantly taking pain relievers is you're just basically damaging your liver. And in fact, when you actually look at people who take daily or near daily use of aspirin, Tylenol, Aleve, naproxen, things like that, it actually can cause rebound pain. So the brain actually will give you pain so that you start taking more of these pain relievers. Or why would you wear a brace for everything? Okay? So if your body's not making a mistake, why on earth are you wearing a back brace to walk around? And so that's why, what we say is like, oh, well, I guess if you're chronically inflamed, just like we said last week, well, I guess you just need to wear a brace, take anti-inflammatories, rub some, blue emu on it. And I guess we're not getting to the cause. So people do have a lot of acute pain, but my goodness, they have so much chronic pain. That's caused by you. It's caused by your lifestyle. And once you understand that I'm the one that's causing it, it should be great news. Because if you're the one who's causing it, then you actually can provide the solution to your own problems. So 3 to 14 days. So let's say you have an injury, sprained ankle, hurt your back, hurt your neck. You're going to be in acute pain for 3 to 14 days. And if you are still in pain after that, then what happens is that it's still getting injured, or there's also something happening chemically within the body. See, if someone gets injured and they have a tremendous amount of chemical inflammation, it is very hard for the body to be able to resolve that initial acute inflammation. But the other thing is too, which is going to lead me into the next thing that I'm going to say, which will probably upset a lot of people, but that's fine, is why do I have pain without trauma? So sometimes people come in and they say, oh my gosh, my hands hurt, my wrists hurt, my back hurts. And I said, well, did you hurt it? No, I just woke up this way. And I'm like, well, if you have pain without trauma, guess what? You actually have a lot of chemical inflammation that's going on, which is why I don't think that necessarily it just needs to be adjusted for the pain to go away. You actually are having something happening chemically. This is why when you are talking about the issue of chronic pain, guys, you should handle it physically, yes, but if you are not handling the chemical aspect of it, you are doing a massive disservice, doctors, to your patients. And no, we're not talking about just give them more pain medications or antidepressants. So no matter how you cut the cake, guys, you're going to be in pain for 3 to 14 days because that is a chemical process from the immune system that is there for a reason. Guys, just adjusting things the day after you hurt your lower back is not going to take the pain away. I'm sorry. It's not going to. Doesn't mean that it's not needed. But we tell people the reason why you should in an acute injury is because of early mobilization in the acute stage will actually help it to heal better, because in order to heal an injury, you need movement. In order to heal an injury, you need it to move, and the quicker that you can move it, the better it will be and the better response to healing you will have. Motion is life to the body, and you know that. Motion is always life. So here's the chiropractor's dirty secret. All right, so I'll expose secrets no matter what profession it might be. Remember, we said acute inflammation will resolve in 3 to 14 days, okay? So a lot of, in the chiropractic profession, they're saying, oh, you hurt yourself, come on in, and let's get you out of pain. And so they'll adjust. First day, I'm still in pain. Well, come back tomorrow. And then the pain will go away when it's all healed, when we put it back in place. And then the next day, day 2, it still hurts, come again. The next day, still hurts, come again. Still hurts, come again. And then lo and behold, at day 5, patient comes in and says, Doc, I am feeling so much better. And they're saying, see, I told you to get adjusted. And the reality is it really didn't have anything to do with the adjustment as much as it had to do with the acute inflammatory response resolving itself. And so the chiropractor plays the hero. In reality, it shouldn't be the hero of that. Now, does it mean that I wouldn't do things different? I just frame it a little bit different, and I say this: hey, Miss Jones, you have an acute injury. It's no different than if you had broken your arm. You go in, your arm is in a U, the doctor's going to say, we're going to set the bone, because if you don't set the bone, you're going to have a dysfunctional arm down the road. If you didn't go in and set that broken bone, within maybe 14 days, the broken bone isn't going to feel very bad, and it's going to actually start feeling good because acute inflammation has gone down. The only problem is you're going to be running around with a bone that's in a U position, which will lead to massive dysfunction, arthritic changes, and compensation, because the body doesn't make mistakes. It will adapt to what you're doing to it, and that will lead to more problems down the road. So this is what I tell people. No matter how you cut the cake, it's going to hurt for 3 to 14 days, but what we're going to do is we're going to make sure we keep it moving as quickly as possible so that it heals in the best possible way and position to put you in a better position and become more resistant to injury down the road. Now here's what's also interesting too is that most people live their lives just trying to handle acute inflammation. They do nothing for chronic inflammation, and so they just go on this merry-go-round of just doing things for 3 to 7 days and then forgetting about it, and they get out of acute inflammation and then they say, good, I guess I have nothing to worry about. But guys, when you talk about true tissue healing and repair, and it doesn't matter if it's a joint, it doesn't matter if it's the gastrointestinal system, it doesn't matter if it's the heart, if it doesn't matter if it's the vascular system, is that true tissue healing and repair can take 12 months, in some cases 18 months. Let me say that again, 12 months, which is why I always tell people it's going to take way longer than what you think it's going to. It really is. And in fact, you only start feeling better when you start lowering inflammation, but you still, after that, you need to actually repair and regenerate. The first step is only inflammation, and then you have to repair and regenerate after that. So tissue healing actually takes, guys, a very, very long time, okay? Now, when you talk about chronic inflammation, the unresolved, so when people have issues with cancer, people have issues with autoimmunity, people have issues with cardiovascular disease, type 2 diabetes, people have issues with chronic joint pain. The only reason why that can happen with chronic inflammation is, number one, you are deficient. You're deficient. You're actually not feeding the immune system the constituents and what it needs in order to build healthy immune system cells. Or then number two, you still have a sliver. There's still a sliver that is inside of you. And so that sliver can take the form with a lot of different things. But remember, if you have a sliver, the immune system will always work on it, always, until it can actually push it out of the body. I actually had a conversation with a woman we've been working with her for the last 6-7 months, starting to feel really awesome, start feeling really great. And I said, well, okay, now let's figure out, let's work on one of the reasons why your immune system did this in the first place. And in her case, it was actually because she has breast implants that are about 15 years of age. That's a sliver. That's a foreign body within the body that the immune system will start working on it from day one. The longer it's in there, the more it's going to cause more problems. So remember, you don't want anything in your body to react to that it doesn't need to. This is why things like food allergies are so important. This is why not putting implants are so important, because your immune system should be primed and ready to handle truly what it's supposed to, and that is with bacteria and viruses at the barrier, not bypass the barrier and going straight into the body, which is done many times to kids every single year. So guys, when we talk about chronic inflammation, what causes it? Here's your 40,000 foot view. It's mental stress, it's chemical inflammation, and it's physical trauma. It's those three things. That's all that it can actually come from. It's those things, which is why, do we handle physical trauma? Absolutely. Chemical inflammation? Absolutely. And mental? Absolutely. And this is the way that we should be practicing a carpenter approach in order to help build a person up. Guys, you can go to the doctor, they can put out the fire, but the problem is they put out the fire, but who rebuilt your house afterwards? Who figured out why it happened, and who figured out how to rebuild and repair and remodel that house? Because so many people get fires put out, they never rebuild their house, and they're living in a house, which is their body, that is very decrepit, that is rotten, that is decaying, which is why in the United States, we lead the world in years of life being chronically ill. So the great thing is we're keeping people alive, but we're keeping also people chronically sick, because we're never trying to figure out the reason why. And what it comes down to, guys, is it comes down to finding the reason why, but it comes down to the immune system. It really does. The immune system, which is what we neglect so much when it comes to health. So guys, coming up, you'll see this pinned to the top of the page. Make immune systems strong again. This is actually our next upcoming in-person event. I believe October 7th, 2020, on a Saturday, I believe at 10 o'clock in the morning. And this was the talk that literally started it all, started a revolution when it came to a different perspective when it comes to the immune system. But we're going to talk to you on that day. This is how the immune system works. Who says so? The physiology textbook. This is why doing these things don't make sense, but this is how you build an immune system response. And we'll be updating some of our research on the success of some specific gene therapeutics, why they've been a complete and utter failure, but also, guys, here are what your rights are when they try to take those rights away. And so at that talk, it's going to be a little bit longer, 2 hours. I understand that you guys have things that are going on. So do I. But I think in this case, when it comes about being able to protect yourself, protect your family, and understand how to build health with your family, I think that this is an important one to be at. I know that I will be, and I hope that you guys are too. So guys, if you are from the Chicagoland area, please go up to the top of the page. You'll see the link to Eventbrite that you can register. This is free to attend. The only thing that we say is, guys, if you cannot make it, please do not register for that event, because there is limited availability. I believe only 50 people that we can seat at one time. So make sure that you are committed to guys being there. So guys, thanks for joining me. I know that I went a little bit early, but again, if someone's going to miss this, because normally they're used to me going on at 7:30 at night, just make sure that you tag them, make sure that you share this video with them so that they can catch up. And guys, I hope you have an awesome, awesome Monday, a great rest of your week. I'll be on Wednesday evening with something interesting in regards to saturated fat and cardiovascular disease. Interesting topic. And so I hope you guys join me then for that live video. So guys, be blessed, be well, remember who you are, and we'll see you soon.